This is the ISSP podcast. The International Society for Sports Psychiatry, or ISSP, aims to carry the science and practice of psychiatry to the athletic community. My co-hosts and I are all medical trainees between medical students and resident physicians who plan to specialize in psychiatry. And we host conversations around the intersection between mental health and sports. Welcome. Hello and welcome. This is the ISSP podcast, where we investigate the intersection between mental health and sports. Today, we're going to do something a little bit different. So I'm your host today, Roy Collins. I'm a psychiatry resident here at Stanford. And for this special episode, we're going to do just a one-on-one conversation with an expert in a field that we feel like is going to be upcoming in athletics, and especially with both performance and sports and mental health in that intersection. And that topic is going to be how psychedelics can possibly play a role in that intersection. And so today we brought an expert in mental health and psychedelics, and that expert happens to be my co-resident, Dr. Gianni Glick. Gianni, welcome to the podcast.
Thanks, Roy. Yeah, I have expert. I don't know about that term. I'll share everything I know, what I do know, but I don't know if I can endorse myself as an expert. But glad to be here. Thanks for having me.
Well, definitely one of the more experts that I know, certainly. So we appreciate you for having your time with us. So Dr. Glick, Johnny, why don't you tell us a little bit about your journey into medicine and how you at least became interested in this field?
Yeah, absolutely. I wish it were a clean story. It probably isn't. What I pieced together is a long-standing interest in basically how emotional connection can lead to healing, psychological healing, and then also physical healing through this complex web of the brain and the immune system and the nervous system in the body. And this led me to medicine and then to psychiatry. Along the way, had a growing interest in psychedelic-assisted therapy. Really curious about how, with psychedelics on board, people may have experiences of deeper connection and deeper insight into who they are and what's going on, and then how this could lead, in some cases, to less suffering. So this personal interest of mine paralleled this growing resurgence of clinical studies with psychedelics in the last 2 decades, and that converged on landing at Stanford in the last 3 years and trying to bring awareness to psychedelic-assisted therapy and research as a psychiatry resident.
And when we talk about psychedelic-assisted therapy, I think people think about, psych medications, SSRIs, antidepressants. They think about talk therapy, right? We think about the old Freudian laying on the bed and having someone in a tweed jacket kind of looking over them. Where does psychedelic-assisted therapy kind of come into the mix there?
Yeah, great question. I think we can start maybe really zoomed out. Sure. And we can say that, psychedelics encompass this enormous range of different plants, different molecules, and different kinds of experience and different worldviews of use and frameworks of use. So I should say, psychedelics as plant medicines have been used for thousands of years, completely outside of medical context. It could sometimes mostly ceremonial or ritual or sacred use, and that's really not what we're talking about when we say psychedelic-assisted therapy, which is a more modern Western concept. If you just take a cross-section of use today, it also does, medical use is a very small piece of that. There's also sacramental use, so-called underground therapy. But there's also recreational use, which is the great majority. And that is people taking psychedelics in a lot of different contexts without a medical provider, without a therapist or guide of any kind. And I think we should just be specific when we talk about which frame or domain we're talking about, because they're very different. They come with different implications, different risks, different benefits, et cetera.
Right. Yeah. And I think we should also define what a psychedelic could be. Even we talked about different plants and compounds have been used for thousands of years. I'll just say something that come to mind, and you let me know kind of where it fits in the frame. So I think about LSD as a psychedelic. I think about MDMA as a psychedelic. Psilocybin is probably one of the more widely accepted ones, and I know one that we want to focus on today. What are some other examples of psychedelics, or where does that all kind of fit in your mind?
Totally. Yeah. Agree on those. Those are the main ones. The most researched three, I'd say: MDMA, psilocybin, and LSD. I think broadly they can be split between so-called classic psychedelics, which mostly affect the serotonin 2A receptor, and that's psilocybin, LSD, and then DMT or dimethyltryptamine. And then you have ones that don't really fit that so-called tryptamine or classic psychedelic category, and that's where MDMA falls in. So MDMA is sometimes called an entactogen or empathogen. It works on the serotonin system in a different way. And that split maybe is the highest level split. You'll also hear, ayahuasca talked about, which is a brew of different plants. It's can involve many different kinds of plants, but one containing DMT or dimethyltryptamine, and then one containing an MAOI, another plant that inhibits the breakdown of the DMT. I'd say those are the most commonly talked about and studied and used ones. There's also ketamine, but that's kind of its own can of worms that doesn't, I think, relate as much to sports medicine or our purposes today. But happy.
Sure. Yeah. I'm glad you brought up ketamine. Where do you does that fit in the psychedelic space? Because it definitely, we use it a lot, not a lot, but we use it somewhat as a depression adjunct treatment to help with treatment-resistant depression. So do you consider ketamine a psychedelic?
It's a great question. The answer is it depends on who you ask. I do. I think ketamine can produce psychedelic experiences when used in a particular way. And most of the research in psychiatry in the last 2 decades has not been seeing ketamine as a psychedelic, more a biochemical sort of under the hood medication, mostly for depression. The distinctions involve the route of administration. So in the biomedical model, it's intravenous, it's infused over 40 minutes at a fixed dose for the most part. And the psychological or subjective effects are not taken seriously as a component of the therapy. They're almost seen as dissociative. They're labeled dissociative and seen as side effects to be minimized. There's some validity to that. There's some reason that we maybe should be careful to minimize unpleasant effects. The psychedelic therapy model and the use of ketamine in that context sees the subjective phenomenological in the moment experience of being on ketamine as integral to the healing process. And that involves preparation beforehand, sitting with during, integration afterward, and usually sublingual or intramuscular.
Okay. Well, thank you for that beautiful breakdown. I want to get to some of the science that we talked about as far as how some of these psychedelics can better someone's depression, better someone's mood. We talked about how they can help with serotonin. We know that serotonin is an integral neurotransmitter that is involved with mood, sort of generally speaking. You even talked about one of them having an kind of an MAOI effect, which covers a lot of different neurotransmitters, but serotonin kind of being one of them. I wonder if you can give us more context into what the science actually is behind psychedelics being helpful for serotonin regulation.
Yeah. Totally. This is an ongoing question. You'll see if you look in the last few years, papers published in Nature and Science, neuroscientists trying to get at this question of mechanistically, how are psychedelics helpful? I guess to step back a step, the first signal that psychedelic therapy could be helpful in mental illness dates back to the early 50s. Before they were made illegal, there was about 2 decades of research across psychiatric hospitals in this, actually internationally, showing that it's something like 1,000 different studies with 40,000 people. There was a signal that it could be helpful in things like terminal anxiety associated with a terminal illness, alcohol use disorder, etc. But they were not those trials. It was like the Wild West in psychiatry back then. It was a very experimental era. It's not double-blinded, controlled in the same rigorous way that we try to do so today. Anyway, so you got this 2 decades of kind of uncontrolled research that showed a signal for efficacy that was then tucked away and put on the rug in this dark era, or the dark ages of psychedelic research. Then
Right.
it comes up again in 2000. Well, maybe around 2000. The first big paper is 2006, coming out of Hopkins. And the last 2 decades, and I will get to the mechanism, I promise, but the last 2 decades have been using psilocybin mostly in
Uh-huh.
a very specific model of psychedelic therapy, which we can talk
Hmm.
about, for the
Hmm.
treatment of, so far it's been depression,
Hmm.
treatment-resistant depression,
Hmm.
alcohol use disorder, really small study, smoking
Hmm.
cessation, really small
Mm.
study, pilot
Mm.
study,
Mm.
um, anxiety and depression associated again with a terminal illness, in
Hmm.
many cases cancer, MDMA for social anxiety
Hmm.
in autistic adults,
Hmm.
MDMA for post-traumatic stress disorder,
Hmm.
and maybe even a few others that are, and actually and a few other smaller studies. So why does it appear to be effective?
Hmm.
I should say that in every study that I just mentioned, they've been relatively small and
Hmm.
they've shown really strong effect sizes. Um,
Hmm.
Results have been significant. They've been sustained over weeks and months in many cases, up to a few years when they follow up. And these effects appear to happen across these diagnoses I just mentioned, suggesting that there's some common underlying process that psychedelics may be acting on in the brain or in the psyche that
Hmm.
reduces suffering or in some way. So that begs the question: what's going on in the brain? How are psychedelics working?
Right.
And this is just this really rich field of neuroscience that people are digging into.
Hmm.
Just like a few weeks ago, there was a paper published in Nature
Hmm.
um, looking at fMRI data with psilocybin in one of the depression trials. And the big picture finding, and this does relate to serotonin in a way we can talk about, but the big
Yeah.
picture finding is that it reduces high level networks in the brain. The default mode network gets a lot of attention. That's one of them. The executive network, which is about executive control or task switching. And
Hmm.
then I think also the salience network,
Hmm.
which is about switching from external to internal, what is salient in your experience.
Hmm.
Basically, it helps the brain talk to each other, parts of the brain talk to each other in ways they are not typically doing, and
Hmm.
in a way loosens the rigidity of entrenched networks. So it loosens the
Hmm.
rigidity of these high-level networks.
Hmm.
But these are all based on small neuroimaging data. It's speculation.
Yeah.
I'll pause there. That's kind of a lot of.
No, I appreciate that. I think the breaking down of entrenched networks is something I want to continue to explore. You know, in some of my readings about how specifically psilocybin could be helpful, I've heard that it can kind of melt your ego or dissolve, again, maybe some of the personal identity issues or things that are, again, there seems to be some synergy between, again, kind of what's entrenched and how one identifies himself. I wonder if you can maybe speak more to that.
Great point. Yeah. So if you look at, there's literature where they ask people, what did you experience when you were on psilocybin in these clinical
Hmm.
trials?
Hmm.
And people talk about, subjectively report, when you observe what's happening in your own psyche, people will sometimes report uh, seeing the world in a new way, feeling
Hmm.
like the typical boundaries of their ego are dissolved or at least weakened,
Hmm.
um, allowing new information to come in,
Hmm.
having perceptions that they wouldn't ordinarily have. Um, so that has led to this labeling of this idea of ego dissolution, or you hear
Hmm.
about melting the ego.
Hmm.
So you could do like 10 hours on, what does that even mean? What is the
Right.
ego? You know,
Well, how do we think that affects someone's mood, someone's anxiety, right? Like, why do we think that dissolving someone's ego is going to improve their mental health?
yeah, perfect question. So let's just say that the ego is the set of psychological strategies you use to organize information in the world.
Uh-huh. Uh-huh.
There's chaos of information out there, and it's processed through certain channels that are maybe habits of thinking, ways of interpreting the world and yourself. We know that a part of conditions like depression and anxiety involve a way of a rigid pattern of thinking in some cases, sometimes a negative cognitive bias and
Mm.
certain rigidified ways of thinking.
Mm-hmm.
So in some ways, the model of the world is a little bit constrained. The idea, the proposal, is that psychedelics in some way are loosening these ruts of thinking. This relates to this idea of brain networks talking to each other that normally don't. So this is a massive simplification. So just total caveat here, but it's been suggested that the so-called default mode network, which is a network in the brain that's active when you're at rest, it's involved in self-referential thinking when you're daydreaming and ruminating a little bit, thinking about yourself. That this is there's more activity in this network when you're depressed and in other conditions, and that psychedelics have been shown to reduce activity in this network. So this neurologic circuit phenomena may map onto the subjective experience of ego dissolution, or loosening these typically rigid ways that you're thinking about the world or interpreting events, which in a condition like depression or anxiety could be helpful.
It's really interesting because when we think about therapy, psychotherapy, right? The whole kind of science behind psychotherapy is you have these neural connections, and we want to make new ones, right? These connections are leading to bad outcomes. They're putting you in a position that's leading to therapy in the first place. And so we want to open your mind to a different reality, right? Different neuronal connections that will kind of lead to better outcomes. And so when we think about psychedelic-assisted psychotherapy, it sounds like what we're doing is sort of going about the same pathway from two different dimensions, I guess. Is that fair to say?
It's a great point. Yeah, I think that's why a lot of the focus of the research has been really it's therapy. It's psychedelic-assisted therapy. Now, there's a whole bunch of people who are studying psychedelics, want to study it on its own, and that's a different ballgame. I think exactly to your point, we know, at least on the sort of cellular level, psychedelics, such as LSD and psilocybin, enhance this process of neuroplasticity, forming new connections between neurons, forming new spines on the neurons. And so in therapy, yeah, I think the part of it, involves forming new connections, forming new ways of thinking. And it can be thought that sort of the suggestion, I think, is that psychedelics enhance this process, enhance the plasticity of what therapy may already be attempting to do.
I know that the history of psychedelic research is just full of controversy, full of politics. There are these kind of dark ages, right? That is probably its own podcast episode, if not it's kind of series of episodes, right? But I think what we can probably distill a lot of that down to is the fear of people using it recreationally, kind of getting high, as they say. So what would you sort of, how would you segregate someone who's taking psychedelics in a way that's unmonitored and doing it recreationally, doing it for the intoxicating effects versus kind of what we're talking about, which is more, again, regulated, more strategic?
Yeah. Great question. And I feel like this is where I feel like we all have to kind of be careful about imposing our judgments about drug use, because people use drugs for all different reasons. And, I think it's just best for us to have curiosity about those ways and kind of a non-judgmental stance. So yeah, so I guess we could think about I think about it in terms of a harm reduction perspective. So there are ways to use a psychedelic, knowing what we know about them, that they increase vulnerability to intense sensations, that they may lower these psychological defenses. So knowing what we know, there are ways to use psychedelics, even recreationally, that may be more safe or more likely to produce a useful or meaningful or positive experience. I guess psychedelics, LSD, psilocybin in particular, are less often used, I guess, to get high in the sense that, say, maybe alcohol or cannabis. I feel like I'm stepping on tricky grounds here because everybody's relationship to drugs is different, and it's not really my place for anyone's to judge it, but they're less often used to get high because of the intensity of the experience. So if you wanted to feel good, there's way easier ways to do that than to take LSD. So I think epidemiologically, LSD use is a little bit less, say, how do I say, pleasure seeking or kind of
I
like,
see.
hedonic than other drugs.
Yeah, yeah.
Yeah, and I should say too, again, the medical, what we're talking about and what I talk about mostly at Stanford is this like psychedelic therapy model. People on their own have been and can use psychedelics in their own safe, like personal, aligned with their personal goals, ways that don't involve the medical community whatsoever. It's just a different kind of thing. It's not really my place to comment on that.
I hear that. I hear that. Let's move it back to some of the clinical trials that have been kind of put out there and produced. There was one recently that came out that it's been under some controversy. I wanted to see what your opinion on was that showed that psilocybin could be as helpful as antidepressants for depression. What are your thoughts on that survey?
Yeah, this is great. You'll have to kind of like shut me up because there's so much to talk about with this study. But basically, I think it was, I want to say about 30 participants between 30 and 40. And it was, I should say this, they made excellent effort to control this and design the study such that we could trust the results. And it turns out it's very complex, but basically it was about 30 something people. They were split into two groups. One of them, and the study lasted 6 weeks. One of the groups got psilocybin twice in the course of that 6 weeks and took a daily pill that was and that was a placebo. The other group got Lexapro or Escitalopram, which is one of our bread and butter SSRI antidepressant medications. And they took a very, very low placebo dose of psilocybin twice. Put them side by side, and then you measure depression after those 6 weeks. Now, here's the tricky part. The main outcome measure that they defined before the start of the study was the QIDS, the Quick Inventory of Depressive Symptoms, I think.
Yep.
On that measure, there was actually no significant difference between Lexapro and psilocybin for depression. They also measured a bunch of secondary outcomes, including different ways of measuring depression, different scales for measuring depression. And on most, if not all, of those secondary measures, psilocybin outperformed escitalopram. But for the main primary outcome, there was no significant difference. Now, you might say that's in some ways a failure, but you might say also, at least as far as 6 weeks, there's no significant difference, which in some ways is kind of big news because they only took psilocybin twice versus they Lexapro every day for 6 weeks. I think the biggest caveat to this is like, we know SSRIs take time to work. So I would be really curious to see the outcomes at 12 weeks. I would want to see a person who's taking Lexapro, at the 8-10 week mark when they've been taking it for longer. Right.
Yeah. Well, I think that's very interesting. And I agree, probably longer time for the Lexapro to really kick in to kind of understand that, but certainly different options. So I think that kind of leads me naturally into my next question, which is who would you recommend? Let's start with psilocybin, which I think has of the three, MDMA, LSD, psilocybin has kind of been like the leading horse right now as far as kind of mainstream availability and even usage right now. So if I am somebody and I struggle with insert mental health diagnoses, when would you recommend that I consider psilocybin?
Yeah, great question. I should also say too, I guess I bet many people listening already know this. So but in case anybody doesn't, psilocybin is the name of the tryptamine molecule that is found in many different species of mushrooms, psilocybe mushrooms, one of which is Psilocybe cubensis. When most people talk about, so in all the clinical trials, they're using that single psychoactive molecule they've extracted or synthesized in a capsule. When people talk about using shrooms or mushrooms or psilocybin, in almost all cases, they're talking about actually eating the mushroom, the dried mushroom. And it's kind of up for debate whether there are significant experiential differences between the mushroom and the psilocybin, but they're pretty close. I think most people would say they're fairly close in terms of subjective effects. So to your question, which I will answer carefully, tread carefully.
Yes.
As you know, this is like totally not medical advice. I think, if a person is struggling with a mental illness or any kind of condition that you've heard there's research using psychedelics about, my best recommendation, this is what I would tell my mom or my sister or anybody, is to try the things that we have the best safety data about first. It's a straight up a safety question. So I would recommend therapy. I would recommend trying medicines that we know work in some cases, not as the end all be all, but as something that we know does help some portion of people. If after many of those things haven't worked and you're really feeling depressed, depression comes with its own risks. And if it's not being treated, that's itself is a risky state.
Right.
The truth of the matter is, sitting right here, April 2022 on this podcast, I totally can't and won't say that, psilocybin or any of these should be taken as treatments for depression, because it's just not where we are in the science. I can talk about, use from a harm reduction perspective. I can talk about, the data that we do have showing efficacy. I can talk all about how they did it and how they chose the participants and why we think it might work. But I guess I can't yet stand here and say, give advice.
Well, one quick clarification. So I was purposely vague into what diagnoses, but all the data has been specifically for major depressive disorders. So what I would say, if you have psychoses, probably not a good idea. If you have bipolar disorder, we have no evidence that would be helpful for bipolar disorder. So we do know that for major depressive disorder, MDD, depression, that is where we have the most data, and that's kind of where I would start. So, oftentimes anxiety is concurrent with mood. So there's nothing to say, it's not like contraindications, we might say. But I would start there, meaning there needs to be some depressive disorder diagnosis first, right? You would agree with that?
Yeah, and I should say too, you make a great point. So every piece of data that we have in the last 2 decades has come from a population that's heavily screened. All of the participants in the trials are only in those trials because they had no history, no personal or family history of any psychotic disorder. That means no psychosis, no schizophrenia, no bipolar disorder. All of those have been excluded from the study. And that is because there is this, I don't know how to exactly qualify it. There is this presumed or possibly real risk of exacerbating or triggering psychotic episode from the use of psychedelics. The data about this is really tricky to sort through because it's coming from things like emergency room visits or use out there in the wild. And there's a lot of confounding factors. So we can't yet say that it does or it doesn't exacerbate psychotic disorders, but there is at least a small risk of this. So we can say full stop, if there's anybody out there with a psychotic disorder, that it's probably unwise at this moment to be using psychedelics.
Any other major adverse effects, any other side effects you think people should be cognizant of when considering something like psilocybin?
Yeah, I guess I break it down into the psychological risks or the side effects, and then the physical ones. Talking about, and we should be clear, if we're talking about LSD and psilocybin, the physical risks are fairly minimal. So they're going to increase heart rate and blood pressure a bit. So, in the studies, people with unstable heart conditions are also excluded. But, in the Johns Hopkins study, for instance, they're giving these pretty high doses of psilocybin to people dying of cancer. It's like different organ systems in their body are, near failure. So relative to some other drugs we give, it's safe in that physical sense. Then there's the whole question of psychological risk. You'll hear a lot about bad trips and challenging trips. And, to call them challenging, I think is a little bit of in some cases that's totally appropriate. But for anybody who's had a bad trip, you'll know it's terrifying. It's really not constructive to be in full panic mode and not have a place to understand that.
Mm-hmm.
And that's a very real risk, is
Mm-hmm.
kind of disorientation and anxiety
Mm-hmm.
that can come from a psilocybin experience that's not well prepared or not in a really safe setting, or like I'm careful not to like advise anything, but there's set and setting is so crucial to inclining the experience toward a good or a bad experience.
And note on that, from what I've read, a lot of the trials for specific psychedelic assisted therapy have been super controlled, like down to the temperature of the room, the color scheme of the room, the furniture in the room, right? So in kind of thinking about those settings, again, very important, making sure that it's very safe for the person that's undergoing psychedelics, right?
Exactly. So we take this idea of set and setting super seriously, because we know that psychedelics the effects are very context dependent. So you take Lexapro in your room, or at a rave, or in your mom's basement. Lexapro will affect you the same, or Tylenol, or
right.
Oradone or something. Psychedelics, very different experience. In a rave, at a festival with people you don't know, versus in a maybe a quiet forest that's peaceful with a trusted friend and a backpack of snacks and a blanket, whatever it may be. Really different kinds of experience. So yeah, in all of the trials, it's a lot of careful preparation, knowing what the experience might be like,
right,
having comfortable room settings, couch, eye shades, music, and kind of having a plan about how to integrate and deal with intense emotions that come up, or challenging experiences.
And so this is a sports and performance space. And so I would like to definitely make sure we cover that as well here at the end of our interview. Both of us, sounds like anecdotally, have heard that it can be potentially helpful, or athletes may be using specifically psilocybin for performance. How can we hypothesize what might be some of the benefits we think for use of psychedelics in an athletic performance space?
Yeah, I should say that everything I'm about to say is total speculation. So
sure,
because there haven't been studies, it would be interesting studies to do. Randomize a group of athletes to, it won't happen. Ethically, we can't do it. Doesn't make sense. But we should also specify, I think, high dose psychedelic use versus microdosing, which we can talk about a bit.
Right.
I don't think anybody is like taking high doses of LSD and then going to the soccer game or playing. And there are these fun historical stories of like this, baseball player, a pitcher, I think it's Doc Ellis. He like takes LSD, forgets he has a baseball game, and then it pitches a no-hitter or something.
Sure. But specifically, yes, microdosing is more what I was referring to. Yeah.
Totally. So just to define it, microdosing psychedelics is using anywhere from about let's just say an eighth to 1/15 of a normal dose. So LSD, let's say an average macro dose is between 100 and 200 micrograms. A microdose might look like anywhere from 5 to 20 micrograms. Some people will tell you that it's subperceptual. Some people will say that they take it and they couldn't even tell you they were on it. It's totally below awareness, and they go about their day with these hoping for like very under the hood effects. Other people will tell you that they do feel something. It's subtle. It's not so disturbing, but it makes them a little bit more open-minded, makes them a little bit more clear. Some people in Silicon Valley use it almost like as a kind of like focus aid. It makes them, work more efficiently. You'll hear different reports of the microdose experience. So there's some variation there. Anecdotally, I have heard of some people talking about using one of these very low microdoses, and then continuing on to an activity they like, a sport that they do, and finding that they feel a little bit more clear or more sharp. To my knowledge, I think you did point out one study. I think we had emailed looking at this, but all the data about this is observational.
Right.
No studies. Really don't want to suggest that it makes you a better, football player or soccer player or anything like that. Anecdotally, we hear these like scattered reports of changes in how people can focus. Yeah, I guess we can. One, again, complete speculation here.
Sure. Yeah.
But taking this idea of LSD in the brain, say, or psilocybin, and opening new channels of communication between brain areas, diminishing a little bit the rumination and this sort of default mode network stuff. But imagine that maybe in some sports performance, a lot of thought could maybe get in the way, like
maybe a lot of like performance anxiety, for example, or doubt about one's abilities.
Right. And it could be that a microdose of LSD just tilts the brain in some way that allows it to dial into the activity or the sensations in their body, maybe pushing to the side a little bit some of the potential rumination or thought or concern or self-doubt that might get in the way. Now, I should say, it's not something I've tried, and it very easily could swing the other direction.
Certainly, right.
If you want a good performance anxiety drug, take propranolol.
Right.
Don't take LSD.
Right.
Game day, at least. So really could go both ways. It could increase anxiety, but it might also have the effect we just talked about.
Right. And it sounds like physically, we'd also want to be cognizant of, again, heart rate, blood pressure. Don't want someone to be all of a sudden hypotensive or even hypertensive and run into issues or have differences in arrhythmias that can cause problems. So sounds like we would not advise, again, folks to be doing this without doctor supervision.
Agreed. And I should say, maybe I was just, using a bunch of words, and maybe the way to summarize anecdotally what people talk about is feeling more present.
Yeah.
And so
that would make a lot of sense. Yeah.
You might speculate that feeling more present in contact with your body and sensations and whatever could lead to changes in performance or improvement in performance, whether that's sports or work or social relationships. But again, it really could go either direction.
Yeah. Well, I feel like we could talk for hours, Gianni, but I'm so happy to have shared this conversation with you. I think that there's definitely more work and more research to be done, especially in this performance space. And maybe we'll see Dr. Glick's name on some papers. We'll have to see. But thank you so much for your time. I can assure people will want to know where they can follow your work or learn more about these topics. What would you recommend as far as resources to follow you and the topic in general of psychedelics and performance?
Yeah, absolutely. I mean, in some ways you can't avoid it. It's all over the media. There's so much hype. We tried at Stanford. We put together our Stanford Psychedelic Science group. We have a website. It's pretty easy to find, just Stanford Psychedelic in Google. And we try to curate a lot of educational resources, studies, and things to read. So there's a lot to be found there. That's good information. We also, on there, you can find, we host talks by speakers every so often that are open to the public and free. Okay. And yeah, I'd say those are good places to start. And I'll leave it to you, Roy, to bring in that sports psychiatry and performance aspect to it, maybe a collaboration in the future.
Okay, well, definitely looking forward to it. But thank you again, Dr. Gianni Glick, for your time and for joining us, man. It was a pleasure.
Thanks, Roy. Appreciate it.
All right.
Thank you so much for watching or listening to our content today. Please like and subscribe to our YouTube and podcast channels and share this episode with your friends and colleagues. Also, follow us at Sports Psych ISSP on Twitter and Instagram, or you can find us on Facebook as the International Society for Sports Psychiatry. Are you a medical student, psychiatry resident, fellow in a psychiatry subspecialty fellowship program, or a psychiatrist who has completed a psychiatry residency program interested in learning more about sports psychiatry? Join us and become a member of the ISSP. We have a free open source certificate of additional training in sports psychiatry program. For more information about our certification program, membership, or other inquiries, go to our website at sportspsychiatry.org.